anticipate nobody could actually hear me at the beginning, so I will restart from the beginning. So I'll go ahead and mute everybody just for the moment, but you can't unmute yourself if you need to ask a question live. Otherwise, chat box is open and you can type up anything that you didn't need to speak of. So sorry, everybody. I had some slight technical difficulties, and which is always embarrassing considering I worked in IT before I went to med school. So, but if you can hear me now, we'll get started. So I said a little bit earlier that I started Apollo in August so that I could focus on heart attack and stroke prevention. I'm much more interested in preventing the disease than treating the full-blown effect. And so this can focus on getting to the root cause of disease by using advanced lipid panels and using some of the advanced imaging techniques, the carotid intimomedial scans, the endopats, and of course the standby, the CT coronary calcium score. And so a couple of months ago, I added Amanda LaPlante on as our kind of resident health coach. I've done a few podcasts with her, and those are available on her website. It's on SoundCloud if you ever want to hear any of the recordings I did with Amanda. But Amanda's been doing a great job with a couple of my patients. We've had a couple of patients lose over 20 pounds since working with her. They're getting off a lot of their antihypertensive medications, and she's just helping those people stay accountable and get the results that they want to get. So in February, I went to somewhat launch a different kind of platform and have Amanda be involved with it. And that, Zoom is going to be the platform of choice for this, where I've been doing a lot of business coaching in the past year, getting ready to launch Apollo, and this is kind of modeling a little bit of ways that these business coaches do it, is they basically have a hour-long, maybe a 2-hour-long Zoom call once a week, where people log on like this, ask questions, and get their the pain points answered, and then they basically retreat to the Facebook group where they can get in and ask the questions during the middle of the week. So I'm going to launch this in February. In the meantime, Tuesday nights are basically reserved for me to kind of explain what the program is going to be about. And if there's time left over, we can answer some kind of straightforward Q&A. But I'll send out a poll in just a few minutes that will have some of the things we'll be probably talking about in February. But essentially, most likely right now we're leaning towards Monday night being the night that the main education will happen. Probably 6:30, somewhere in that range, depending on what most people want. And then myself will be included, but we'll have a lot of talks done by Amanda, or maybe even have some outside speakers come in and give pointed talks on whatever people want to learn about. So basically, February is going to be the launch. Once a week, there's going to be Monday night talks, while the Facebook group where we can interact in between. And then Tuesday nights, basically, I'm going to come on like this, basically to just educate people what this program is about. You're always welcome to come back to it, but Tuesday night's going to be basically a rehash every Tuesday night. So you're not necessarily going to learn anything new if you keep coming back every Tuesday night. Monday night's going to be the key night to come back. So I will throw out the poll questions just for a second. And when you guys get time, just try to answer the questions if you can. That will give you a good idea of what we need to focus on in February. So, but launching it in February and probably run it for 6 weeks. The topics will be different every week. And then after 6 weeks, we'll basically have a graduation, and then people can either kind of stay in the Facebook group and ask their questions, and then we'll bring in a new set of people for the following 6 weeks. And after the kind of initial beta test is done, the follow-up testing groups will there'll be some type of fee to continue on afterwards. But for the first 6 months, or first 6 weeks, I should say, there's not going to be any out-of-pocket costs. It's just mostly trying to figure out what people want to learn about, and then we'll kind of fine-tune that message then. So I will unmute you guys, and you can kind of open up any questions about this program, or by the end, if you want, I can tell you a little bit about my experiences hanging out with Jack Cruz last week in Cancun. So. I'll unmute it here. All right, so far it looks like people are answering. I'm going to learn a lot more about energy management, heart attack prevention. I can do that. Definitely can do the sleep optimization. Looks like we're about even on the times of day to start. Looks like Monday, Tuesday are the best nights for Zoom, which that's usually what we imagined.
Hey, Dr. Twyman, we're getting some feedback. Maybe you can use your laptop or some.
It's probably not on my end. I'm not getting anything on this end. It's so maybe what I'll do is I'll mute the group, and if you guys want to chat, just unmute yourself then. All right. So it looks like I know at least one person in the group does follow Dr. Cruz. They might not have clicked on it. So Dr. Cruz is just a pretty famous biohacker. He's a neurosurgeon down in New Orleans. I've learned a lot of the kind of health optimization, mitochondrial optimization stuff from Dr. Cruz. So sometimes when I give these online presentations or do the live ones, like half the group knows who Dr. Cruz is and has read his book. So I won't go too into depth with him tonight then. So all right, so that's kind of the basics of what I wanted to kind of talk about tonight. And now I just want to really kind of get your guys' ideas of, what more you want to learn about in these type of Facebook groups and in these Zoom meetings. So if you don't answer it in the polls, unmute yourself and ask away, or type it in the chat box what you want to learn about. All right.
Hi, Dr. Twyman. So is this just going to be like, it's going to be like a 6-week of kind of like education, or are you, and just what we're interested in?
So it's going to be a kind of a 6-week beta program where, the first 2 lectures Amanda's going to help out with. One of them is going to be, weight management, weight loss, how to optimize that. And then the second week is going to be about how to optimize energy. I'm open to, chatting about whatever topics people mostly want to learn about. If it's mostly focused on nutrition, well, we'll do some nutrition. If it's more about sleep or weight loss, we'll talk more about that. So just want to kind of figure out what the majority of people want to be, educated about, and then we'll tailor the message to them, with these weekly webinars. And then in between, if things come up, we'll answer them in the Facebook groups during the middle of the week.
Got it.
Okay. We had met you this weekend at Angela's.
Okay. Awesome.
And so we were both, my husband and I are both interested in learning more from you. And so if he doesn't have Facebook, through my Facebook, would he still be able to kind of participate like us as a couple?
Yeah, that's fine. I mean, honestly, I'm not a huge Facebook person. I just basically signed up again on Facebook just so I could have access to the Facebook groups, because that's where a lot of the medical education happens, and a lot of the business education. These people have these private Facebook groups where, once you're in there, then just the people who are invited can sit around and ask questions and share articles, share videos. So it's not the usual, like, look at everybody's food and look at everybody's kid pictures. It's more, coming there to learn about what you want to learn about.
Mm-hmm.
Mm-hmm. Good.
Okay, thank you.
So just as a question, did you know who I was before you came to Angela's thing this weekend?
Well, I should say, I actually met you at one of Angela's, the Uninflame Me, first.
Sure.
A long time ago, she had one at a church, and I just remember I first heard you speak there. And then we went this weekend to hear you again, because I really wanted for my husband to listen to you speak as well.
Okay.
And so then I've been following you on Facebook, and you just have a lot of great information.
Thank you for the feedback. Yeah, it's, the interesting thing is that I don't want to blame Angela, but it's almost Angela's fault that I'm doing stuff like this, because I was doing integrative functional medicine in my prior practice, and she came to me and wanted to interview me for what she told me initially was going to be a PBS show. I was like, well, nobody watches PBS, so sure, I'll get interviewed by her. And then I didn't know she was going to turn it into a documentary and put it on Amazon and have me going around talking about it. So she's the one that kind of got me out of my shell to start talking about this stuff. And then 2-3 years ago, I ran into a gentleman that put me in touch with Dr. Cruz. And then that's really when I went down the rabbit hole of mitochondrial health, energy management, all this biohacking. That's where I really kind of learned a lot about health optimization, was doing the following of Dr. Cruz. So, I definitely will, be interested in what people are, wanting to learn more about, and definitely can still, speak to the uninflaming me part of the medicine, but I actually have a lot more tips and tricks than when I spoke in that documentary.
Okay, awesome.
Very good. Thank you.
Sure. Okay. All right. So it looks like 6 of the 7 people have answered the poll questions. So looks like the greatest majority so far want to learn more about how to have more energy, and stress management is the close second. And then looks like the times, Monday, Tuesday, that's going to be the nights we mostly do this. Tuesday is going to be me kind of explaining what the program is, and Monday is myself or Amanda usually giving the talks. So it looks like most people are in a Facebook group, so or at least know how to use Facebook. And okay, very good. All right. So sunflower oils wants more in biohacking, getting rid of negative effects of GMO, electricity, Wi-Fi. All right, cool. Biohacking is a big topic. I mean, it's something that's popular on the coast. It's not necessarily as popular in the St. Louis area. Because it wasn't popular in St. Louis initially, 2 years ago, I started the St. Louis Biohacking Club. It's a meetup group. It's on the Meetup app. Generally meet once a month. Actually, this upcoming Saturday, there's an event. It's free to join the group. You just have to go on the Meetup app to see the dates and information. This week, we're going to do a crowd therapy session at a place in Clayton. So teach people how to use cold therapy to lower inflammation. Question, biohacking, what's biohacking? Biohacking, Dave Asprey, the guy who started Bulletproof Coffee, he's the kind of the grandfather for biohacking. But biohacking, his rough definition is how do you alter your external and internal environments to optimize your biology. So I tend to use it more as kind of a, what health optimization things can you do to yourself that don't necessarily require you taking prescription medications or taking supplements. So the number one biohack type stuff I generally talk about is the light management. So if you can see over my screen left, you can see some red light. I have a red LED bulb that's in one of our lamps. So my house looks like a dark room or house of ill repute or something like that at nighttime, because I usually don't have the bright lights on at nighttime because light affects your circadian biology, and it's really all about your circadian biology for optimizing health. Somebody asked, can we watch webinars later Mondays if we're busy with children? Yes, the webinars will be recorded. Like I said, for the first 6 weeks, it's kind of a demo. We're going to be testing out, seeing what, getting some good feedback here, what people want to learn about. And we'll record the Monday night talks, and I will put those up. I'll probably put a link up in the Facebook group to be able to watch it. I may or may not put it up on my YouTube channel initially, just to let other people see what we're going to be talking about. But then after the kind of the first 6 week beta demo models out, only if you're a member would you still have access to the backlog of the videos then. People also want to learn more about heart attack prevention. Cool, we can do that. I've done a lot more training with Dr. Cruz recently about that. Stress, sleep, nutrition, can do that. The name of the Facebook group is just, I believe it's just a polycardiology Facebook group. If you got the, I don't know for sure if you got it, and you might not have got it, sunflower oils, but there was a group email that went out about a week ago. It had the link in it at that point. Let me pull it up right here. I can get it for you. Just cardiology, and I'll say private group. So if you just search for this on Facebook and send me a request, I'll invite you in then. There's right now 23 members in the group right now. So, right. Somebody had asked up in the other chat part, getting rid of negative effects of GMO. I'm not necessarily an expert in GMO, but I did learn something fascinating about how basically glyphosate truly causes health issues. The glyphosate replaces the glycine and the collagen in the skin, and essentially you can't absorb sunlight as well when glyphosate takes the place of that. So if you're fan of the sun, and everybody should be if they're following me. You need the sun to run different programs in your system, and the glyphosate blocks that. Electricity Wi-Fi. I, I'll do it. I don't know if I'll do it in the first 6-week thing, but we'll definitely can talk about the effects of electromagnetic frequencies or EMFs. If you come to the office, I have a couple different meters. There is a meter, the ENV RD10. This is what it looks like. It's a little meter that essentially tests radio frequencies, which for the most part, for most people, is going to be Wi-Fi or your cell phone tower. So right now, because I'm shining it right by my computer, it's going to be pegged at red because this is on a Wi-Fi network currently. I don't have it plugged into a Ethernet. Sometimes I do, but you can get this device for I think it's about $200 or so. And then you can test your house, you can test your work, you can test your hotel, you can travel. You can see basically where the Wi-Fi routers are, and ideally when to sleep where it's at, where it's all in the green. If you want more detailed nuance, like what these numbers mean, we can do a little bit longer webinar in the future on it. All right. So we got here. Got a question. Managing lipoprotein A. Great question. Interesting article came out today on the Journal of American College of Cardiology. There's a drug in development. It's these antisense oligonucleotides. They're essentially going to be medications that block the receptors for lipoprotein A. So lipoprotein A can't bind and damage the arteries. Lipoprotein A is similar to LDL. It's a particle that's a little bit more atherogenic and thrombogenic, meaning it's more likely to cause the arteries to clot or the arteries to develop plaque. Right now, there are not great pharmaceutical agents for lipoprotein A, and the supplements, mainly niacin, really doesn't have a great effect on it. So mostly treat all the other risk factors for lipoprotein A. You don't really try to lower LPA at this stage. Good, yeah, me too. Beverly has a question. I've been following Dr. Cruz for 3 years. I struggle to comprehend on his level. There's honestly nobody that comprehends on his level, and that's just a fact. I mean, I spent literally 8 days with the man, sun up to sundown, and 90% of the conversation I could follow, but 10% of the time, he's just talking quantum physics, and it's not stuff that I think anybody's really meant to totally understand. But when you actually distill it down, what he actually just comes down to, it is really all about light, water, magnetism. Controlling your outside environment, your inside environment for your lights is key. Water, it's much more important the water that your mitochondria make than it is the water you drink, but the water you drink is important. And then magnetism is really more of a surrogate for cold. You can use cold therapy to lower inflammation and make energy in the mitochondria more effectively. Earth and grounding also is somewhat of a function of magnetism. So the applicability of what you do for Dr. Cruz is actually simple, but if you actually want to understand the biophysics, you have to read some of the comprehensive books that the other doctors and scientists put out, because Cruz tends to write in a very cryptic way. I think sometimes it's easier with Cruz to go back and listen to some of his earlier podcasts when he's talking to a lay person. Sometimes he kind of slows it down a little bit and it's a little bit easier to understand, but typically even those podcasts, you got to listen to 2 or 3 times to really get the full picture. His Vermont videos that he did, they're on YouTube. He did Vermont 2016, 2017. Those are free. Vermont 18, he sold. But those are good starting points if you haven't seen the Vermont videos. Just search for them on YouTube. They're free. All right. All right. Well, I'll keep going for as long as people have questions. While I'm waiting for more questions to come in, I'll talk a little bit more what I've been up to in the practice. I'm fairly busy these weeks giving talks around the area, giving a couple talks to osteostrongs. They're a facility where you can strengthen your bones without medications. It's a biohacking technology. There's a couple different centers in St. Louis that offer the technology. So if you have osteopenia, osteoporosis, contemplate looking at OsteoStrong. The other type of talks I've been doing, I've been going to a lot of different firehouses around the area. I have some family members in the fire service. Firemen have heart disease at an earlier age just because of the stressors they undergo. Mainly it's the circadian rhythm mismatches that they have from their shift work. So go around talking to them about heart attack prevention. So, I'll give you the 10-minute beginning part that I give them usually. So usually tell them that 80% of heart disease is preventable by your lifestyle. So, and it's much more, and if you've seen me in the office, it's much more than just cholesterol, high blood pressure, and diabetes. There's 300-400 different things that are going to cause heart disease. And, there's a couple different tests you can get. If you've already had a heart attack, you've already had a stroke, you have stents, you've had a heart cath, and they know you have plaque, some of these tests aren't necessarily for you. But if you're somebody who really wants to know, are they at low risk or high risk of a heart attack, there's 3 main tests that I recommend people get other than the blood work that we tend to do in the office. The first test I recommend for people is called the CT coronary calcium score. Calcium score is a $100 x-ray of your heart arteries, about the same amount of radiation as a mammogram. The calcium scan tells you, is there plaque building up in your arteries? Yes or no. If your calcium score is 0, you're at low risk of a heart attack and stroke. Work with your lifestyle, maybe supplements. Rarely do you need medications if your score is 0. Calcium score is over 400, you're very high risk. You probably have a 90% chance that one of your arteries is severely blocked up. Between 1 and 400, intermediate high risk. Do you take medications? Probably depends on what your blood work shows. The other test I'm starting to recommend, and we offer it in our office once a month, is called a carotid intimomedial thickness scan, or CIMT. It's a ultrasound of your neck artery that measures the thickness of your artery. The thickness of your artery is somewhat of a surrogate for the amount of plaque that's building up in your artery. The test does not involve radiation and basically will tell you what your vascular age is. If your vascular age is younger than your biologic age, then you're good to go. If your vascular age is older than you, then that tends to be a problem and you want to do something about it. And then the third piece of technology I have in my office is called an EndoPad. I did one earlier today. Fortunately, the guy's number looked good, but the EndoPad is one of the best devices to tell you how healthy your arteries right now. So the first 2 tests just look at, see, is there plaque in the arteries? But it doesn't tell you what is the propensity or likelihood you're going to keep putting plaque in your arteries. The EndoPad test will give you that information for the most part because it tells you how much nitric oxide your body can make. Nitric oxide is the gas that dilates your blood vessels. It's what keeps your blood pressure under control. But nitric oxide is also like Teflon. It prevents stuff from sticking to the arteries. So nitric oxide can be made by UVA radiation. So midday sun tends to make nitric oxide. Green leafy vegetables and beets tend to make nitric oxide. And then physical activity or exercise. Those are the 3 biggest things. So mostly it's through lifestyle. It's not through extra supplementation that you improve nitric oxide. The EndoPad test takes 15 minutes and tells you, can your arteries make nitric oxide appropriately? Yes or no. And then obviously people know that we do the Cleveland Heart Lab panel. We're exploring a couple of options. We might be expanding out to a couple of different companies that do very similar inflammation and lipid particle testing. But if things change with that, that'll be put out here. And also at some point we'd have Cassidy I'll let people know if we're switching anything with the labs. So that's kind of what I'm kind of doing for the screening right now for heart attack prevention is those tests plus the labs. And then all the stuff that people are interested in talking about, stress, sleep, that's what we're going to talk about in these talks. These will be probably hour and a half long discussions, and then we'll definitely have some Q&A time for them, and we'll record them. And so for people who can't watch them, we'll have available for them. Or if there are patients in the office and they're like, what Dr. Twyman talk about for sleep optimization? I'll be like, there's this video online, go watch the video. All right. So is there any other questions I can answer for people tonight? How is the nitric oxide test performed? It's a test performed in our office. It is best done fasting and without any fingernail polish on your fingers. It's basically If you've had the pulse oximetry test, it's the little finger probes. There's 2 of them. For 5 minutes, you're just taking a baseline reading of the peripheral arterial tone in the fingers. Then after 5 minutes, you blow up a blood pressure cuff on your left arm. For the most people, you'll cut off the blood flow to the hand for 5 minutes, so you're going to get that pins and needles sensation in your hand. After 5 minutes, you open up the blood pressure cuff, the blood flows back to the hand, and then if the arteries are healthy, they will release nitric oxide as the blood is rushing back down into the blood vessels. The blood vessels should double in size based off their baseline size, and you have that answer right at the end of the test. Let's see. What are the costs of the test? So going through it all, the CT coronary calcium scan is $100 or $99, depending where you get it. For the most part, that test generally is not covered by insurance. The carotid intimal medial thickness test is $200. Sometimes insurance companies will cover that. There is a CPT code. I don't promise that the insurance companies will reimburse that one, but I always will put down the reason people are being screened with that type of test, give them a super bill, and then they can submit that to their insurance, and potentially the insurance company would cover that. And then the EndoPet test is $225 and gives, like I said, gives you the answer right away at the end of the test. The CIMT usually is going to take about a week for the results to come back. Next question. So if the EndoPet test indicates poor oxide, then you improve it through the 3 factors you mentioned. Yes, that's the main thing is, if you're not routinely exercising, get into a, scheduled exercise routine. From a nutrition standpoint, it's mainly the green leafy vegetables and beets. Yes, there are some beetroot products and beetroot supplements you potentially could take, but if you eat beets and eat greens, don't necessarily need to take a supplement. But probably the number one thing that improves nitric oxide release is UVA radiation, and that's sunlight. So now St. Louis is back out of vitamin D winter, so you can make some UVA radiation hit your skin that dilates your blood vessels and releases the nitric oxide. Then, if those things aren't doing the trick, there are different prescription medications that can help with nitric oxide improvement. But always start with the least invasive and the least costly things. All right. What about heart rate variability? I can tell you what it is, or do you have a question about how to test it or how to best monitor it? So waiting to see if there's any more follow-up questions on it. Heart rate variability is the beat to beat difference of your heart rates. It's measured on a piece of equipment that's measuring your beat to beat differences of your heartbeat. So I tell people your heart rate is not supposed to be, if your heart rate's 70, it's not supposed to be 70 all the time. As you breathe in, you're stimulating different nerves. Your heart rate should expand. Your heart rate should go up to like 80 as you're breathing in, and you blow out, drops to 60. That expansion of your heart rate is the heart rate variability. The greater the heart rate variability, the greater cardiac coherence, cardiac conditioning you tend to be. If your heart rate variability is very narrow, the heart is more stressed. And if you're an exerciser, it is a fairly good marker for that you're overtraining in your exercise. So if you measure heart rate variability first thing in the morning and it's low, it's probably a day that you don't want to push yourself hard in the gym. It's probably more of a deload day. How to improve it? First, figure out why it's low. If you're overtraining, basically detrain a little bit. But if it's a external stressor in your life, then it's meditation, mindfulness, deep breathing exercises, yoga. Try to figure ways to stimulate your vagus nerve. Your vagus nerve is very important for the parasympathetic part of your nervous system. That's that rest and relaxation part. My 2 ways that I personally measure heart rate variability. One, I don't use it so much anymore, but I have a Zoom, just like the technology we're using tonight to talk. There's a company called Zoom that makes a wristwatch that can measure heart rate variability. I also have a Polar H7 chest strap. It's a Bluetooth chest strap that can measure it. There's different free apps you can download. I tend to use Elite HRV as the free app that measures it. And then I don't have it sitting right in front of me here, but HeartMath. HeartMath is a device that's very good for biofeedback and teaching you how to essentially improve your heart rate variability. It's a ear clip, measures your heart rate through your ear, and has a little application. You breathe in and out with it, and shows you, are you basically making your brain and heart talk to each other appropriately. So that's some Mountain Spring Valley water, if you were wondering what I'm drinking right now. So. Question, yay or nay for red wine for heart health? Let's just say it's a loaded question. So I'll make the caveat is that if you do not drink alcohol, you should not start drinking alcohol for any purported health benefits. If you currently drink alcohol and you're a man, 1 or 2 drinks a day generally is going to be at least neutral, possibly slightly positive. You start getting over 2 drinks a day for a man, you're likely headed into negative territory. For women, they lack an enzyme called alcohol dehydrogenase. So essentially they can only handle about half the amount of liquor before they start getting toxic effects. So a drink a day, 1 drink a day for women is generally the limit for any type of quote health benefits. Now the purported benefit of red wine is that it has resveratrol in it. Resveratrol is a polyphenol and an antioxidant that is something that the grape makes to protect itself from high sunlight exposure. I knew that was how it was made, but after hanging out with Dr. Cruz and understanding how resveratrol really works, it's quite interesting. So resveratrol is essentially a UV trap, meaning that it helps absorb UV light, and then as you have the resveratrol in your system, it allows you to basically shuttle UV light to different cells that need that energy. So red wine with resveratrol has some benefits from a light assimilation purpose. So you're able to absorb more sunlight and put it where your body needs it. So for Beverly, that's a definitely a one-on-one kind of medical question, but you are correct. It will be difficult for you. But that's basically heart rate variability is always going to be one of your biggest challenges. All right. Any other questions coming in tonight? All right. Well, if there's no further questions, what I'll do is I'll wrap it up here in just a minute. I did start recording this video. It's kind of like I said, the beta test version of it. If I get it all worked out right, I'll see if I can post this up in the private Facebook group, the Polycardiology group. And then next Tuesday, I for sure will be doing this. I'll double check with Amanda, see what her schedule is. Potentially we'll launch, let's see, next Monday, should actually say, there probably will not be anything next Monday, but next Tuesday, we're actually going to be doing the Center of Clayton. It'll be live. It'll be at 6:30. I reserved the room 6:30 to 8:30. What I plan to do is essentially do this same type of kind of Q&A, poll the audience, what's going on, and if I have decent Wi-Fi or 3G, 4G there, I'll try to record it on Zoom and then put that kind of the Q&A part of it at least up on the Facebook group so people can kind of learn about some of the Q&A questions. So one last question is, can the Jack Cruise followers exchange names for sport? Sure, I have no problem with people doing that. Probably best to do it in the Facebook group, but I would encourage you just, go on Jack Cruise's optimal forum and just tell them where you're at. That's the best way to find local people for Jack Cruise. The local Jack Cruise people, they tend to follow me because they see me posting about it on Instagram. So there's a couple of them around the area. All right. All right, the question, why don't start drinking if you don't already, if there are health benefits? They're actually not that strong. So, and there's people who have issues with addiction with alcohol. So, if you don't already drink alcohol, it's never been recommended to drink alcohol just for the potential of the health benefit. It is much better to optimize your circadian rhythm management, going to see sunrises, drinking clean water than is ever to consider drinking alcohol. You know, Basically the best reason, Dr. Cruz said to drink alcohol is that you're around your, he always calls it his circle of six, or, you're like-minded people and you're raising each other's dopamine levels so that you think better. So more of a social improvement thing. The potential for heart benefits and such, there's not strong enough data that you should start drinking alcohol for that. And yes, thank you, Beverly, for the kind words. So, all right, guys. Well, I do thank you for logging on and sharing your time with me tonight. This is going to be very helpful for me and Amanda to kind of build out this program, and I look forward to the next few weeks and sharing this information with you. And in the meantime, if there's any questions, concerns, just like I said, go over to the Facebook group and ask the questions there. I'll try to get in there at least once a day and answer the questions. I think Amanda's also going to try to work on getting in there and answer some questions. But the best thing you can do for us is just, share this message, share it with your social media groups, and, bring a friend, bring a family member, and have them watch one of these with us sometime. So thanks again, guys, for watching tonight, and we'll be in touch soon. So take care.